Would there be any benefit if radiographic and ultrasonographic evaluations are negative to performing either computed tomography or magnetic resonance imaging? If there is any suspicion of intrasynovial sepsis, then we need to be thinking about the use of systemic, broad-spectrum antimicrobial drugs, lavage of the affected structure, and intrasynovial medication. So let's consider a variety of clinical situations. For example, a horse found severely lame in a field. The fact that it's in a field doesn't necessarily mean that it has done something related to the field. The horse may have a subsolar abscess, and this may have resulted in diffuse swelling in the metacarpal or metatarsal region, which may potentially be misleading. Whenever we see diffuse swelling in the metacarpal or metatarsal region, always evaluate the digital pulse amplitudes. Always apply hoof testers. If the horse has very hard hoof wall and sole tissues, we may need to soften the sole in order to explore it further. You may be highly suspicious of a subsolar abscess, but in order to explore further, we may need to apply a wet poultice for at least 12 hours before we can consider exploring the foot using a hoof knife. And I would also advise that you should consider getting the assistance of a farrier to help to explore the foot, because I know that some of these horses are extremely painful. They are very strong. Once you get into sensitive tissue, they may react very adversely, and the assistance that you can gain from a skilled, strong farrier can be invaluable. If there is a suggestion of penetration injury of the sole, we need to determine at what location it has occurred so that we know what anatomical structures may or may not have been injured. If there is any potential that there may have been an injury or penetration that extends to the solar surface of the distal phalanx, towards the navicular bursa or the navicular bone, then the horse does need to be referred for further investigation. So, for example, this horse, in which a nail has penetrated just to the lateral aspect of the medial aspect of the frog. The nail was in approximately 3 centimeters. There is a very high risk that this may have resulted in contamination of the navicular bursa, and rapid referral is required. This horse did have the navicular bursa flushed and made a rapid and complete recovery. There are a number of other potential differential diagnoses for a horse found severely lame in a field. There may have been a penetrating injury resulting in synovial sepsis. If we consider older horses, by which I would define a horse of approximately 15 years of age or more, there may be rupture of the proximal aspect of the superficial digital flexor tendon, which results in very severe lameness and sometimes considerable distress. The horse may have cellulitis. It may have laminitis.